So we are back here on the Choose954 podcast, episode 58, with Dr. Susan Rashid, a local family medicine physician, who is going to be our next upcoming AAF CreativeZen speaker. If you didn't know about Choose954, we started a social movement to cultivate culture and community here in Broward County, where I'm from, in an effort to keep people in know with all the great things that are going on and make this a better place to live and not just a better place to vacation. The point of the podcast is to connect you with amazing people like her that are doing important things in the community. The podcast is sponsored by the Thousand Mermaids Artificial Reef Project, creating artistically crafted artificial reefs to help provide coral restoration, ecotourism, fish habitat and protection, and countless other great benefits. To find out more, you can log on to www.1000mermaids.com. That's www.1000mermaids.com. But without much further ado, why don't you tell us a little bit about yourself at a high level, Dr. Rashid?
Thank you, Evan. Thank you for having me on your show, and thank you for inviting me. I am a family medicine physician, and I've been practicing on my own for the last 5 years. So I've worked throughout various areas of South Florida, Miami Beach, North Miami Beach, Hollywood, Fort Lauderdale. So I have a good understanding of the South Florida community in terms of the healthcare needs and the vulnerable populations that make up this very exotic and very diverse sector of the USA.
Say the least.
So I also currently, along with being a family medicine doctor, I decided to go back to get some more training and schooling just for fun. And because I love learning. I think we should all cherish being students, when you can, because I think that knowledge is just great. Because it's always changing. Things evolve, things transform, and it's just really good to be in the know of what new theories and new ideas formulate and come into play. So anyhow, I'm working with the Correctional Medicine Fellowship at Nova, and I'm getting my master's in public health at the same time. So I started in corrections last summer with the Department of Juvenile Justice here in Florida. And so I dealt with basically incarcerated adolescents, and I really liked it. It's really nice to see that kids can go back out and, into completing their high school education and getting into college and pursuing great dreams. And, it was just a matter of kind of just getting their priorities straight and just giving them some good guidance and good optimism that, this isn't the very end. You just started your life, and now you're going to start making better decisions, so you don't have to come back into the system again. So that was really inspiring, and so I wanted to see how this played into the adults, and it's been quite the ride. It's been pretty an extraordinary experience, to say the least. And I'm enjoying it. And it's nice to also have the Masters of Public Health that I'm attempting to accomplish, to see how vulnerable populations are viewed, and what are their hurdles, and what are the things that they go through to getting access to good health care and achieving good health. And it's just interesting. And so my days are never the same. They're always pretty busy. And so I'm happy. I'm happy with having so many things to do, and I guess having less time to get it all done.
And it comes at a good time right now with the current situation. So we're forever grateful for you, for all the frontline healthcare workers, obviously, and for everybody that's assisting with the current situation. But before we got into the current situation, how did you initially get your start in medicine? Where did your journey kind of begin?
So in regards to starting my medicine career, I went to medical school gosh, was it 2008? 2008, I went to West Virginia School of Osteopathic Medicine, and I was born and raised in Minneapolis, Minnesota. And yeah, basically, once I got my bachelor's degree, I really enjoy the sciences and learning how to manage and promote good health. It's just something that I felt compelled to do and I enjoyed doing. And yeah, that was basically it. It was just just knowing that you saved a life, and it was because you were able to execute and promote wellness and really care. It's a very caring profession. And you know, it's so nice to see patients that like just, they just really adore you, and they just really like, want to achieve good things in life. And it's so hard to find good doctors, I think, because it's so much more than just being good at managing medicine. There's the emotional connection and intelligence that, you know, solid communication skills and empathy and compassion that, it just comes intuitively with this field of work that I do. And it's not something that, I can just read a book on. It's just something that's in my nature, and it's just nice that I can, really connect it to the health sciences. And so it ends up being rather enjoyable, and it's nice to have those long lasting connections that, you never forget and you just carry with you. And yeah, so that's really why I went into it. In regards to the COVID-19 situation, it's a really unique story in that when I started the Correctional Medicine Fellowship, the end of last year, December of 2019, going into January 2000, I had mentioned, I really think it'd be nice to start a podcast on what really happens with medicine behind bars and for those that are incarcerated. We don't really, they tend to be kind of like, there's so many stereotypical pictures, you could say, of what this vulnerable population goes through, but it's not. Sometimes it's a bit dramatized, it's very scandalous, sensational. Well, let's add some realism to the sensational stuff, what was really happening, with at least with regards to the medical care that the patients receive there. So that was my goal, and still is my goal. It's just that right when I was able to get the podcast started, the coronavirus outbreak had taken place at Wuhan, China. And of course, that was back in early February, middle February. And I was formulating ideas, that incarcerated people go through more so than, the people on the regular society, in that, I want to talk about addiction and opioid crisis that's happening in America right now, and how that's related, their exposure to hepatitis C and what this means when they get out into the community. So many various topics. But the coronavirus outbreak that was happening in Wuhan, China, I got information that there was an outbreak that happened in their vicinity, in their region of the women's prison system there, and just a few other jails that were there, that it had spread rather fast because it's such a close, as you know, prisons and jails they're right next, people, there's not much social distancing that happens there. People, the inmates are basically neck to neck with each other at times. And sometimes the conditions aren't always, the cleanest. They're not always the cleanest. It's not always easy for soap and water access. Alcohol sanitizers are considered contraband. It's a bit of a risk when you give it to an incarcerated individual, because they could do other things with it. So it's a different mindset, different environment. But what do you do when you have this very lethal virus spreading like fire in the prison system? So that's where it was like, well, let's go ahead and talk about that, about what you would do for the first episode. And I wasn't thinking that it was, of course, at that time, no one in America was thinking like this was going to be such a giant pandemic that's basically historical. And I had gotten a wonderful connection. Dr. Harish Moorjani, he's an infectious disease specialist from New York City, and he's in Westchester County. And he was in South Africa when the outbreak had taken place in Wuhan, China. And he had gotten wind that I was starting this podcast, and I was inquiring, who wanted to talk about how do you deal with an infectious disease outbreak in an incarcerated system. And he had a lot of experience during Obama's administration for the Ebola outbreak that occurred around 2014. And he had given guidelines to the New York Department of Corrections and to the New York governor of how to handle the Ebola outbreak in various population sectors, including the incarcerated population. So he had a lot of experience in dealing with an infectious disease outbreak, not only in the outpatient setting where clinics and hospitals, that would be inpatient, but even inside the prison system. So he was really eager and interested. And he also had some really exciting pieces of news about experimental treatments for coronavirus, COVID-19, and vaccine development before any of us even knew about it. So that was really exciting that we had breaking news from my first episode. And I just figured, okay, we'll now carry on to other topics. And because of that relationship that I had my first show and my first debut, you could say, and because I got to have that connection, it's now lasted up until like maybe 5 episodes. And I have some more to produce. Yeah. And it's just on coronavirus and COVID-19 because he just happened to be in the epicenter. Once he basically got back to America, we recorded our first episode. That was the end of February. Within a few weeks, things were rapidly progressing from Kings County, Washington, all the way to the epicenter in New York City, which is where he was at. In fact, the hotspot, he lives in the hotspot in New Rochelle. That was the first hotspot, New Rochelle, New York, in Westchester County. It was the first hotspot for coronavirus, novel coronavirus 2019 in New York. And then it turned into the big epicenter that we all got to see progress ever so rapidly within just a matter of weeks. And so, it's turned into now not only experimental treatments, but also, and vaccine production, but also drive-through testing and how accurate these tests are and how quickly do you get the results back. And then what are the symptomatology? What are the key signs that we have to look for when it comes to this disease process? And then how fast does it spread? Is it 2 people? Is it 3 people? Is it just in the air, or is it just, droplets from the eyes and your fingers and the doorknobs? What is the value of washing your hands so frequently? How is this so effective? And then not only is it for the general population, but what does this mean for the incarcerated population? So there was just so much that it was just kind of like, wow, okay. And I was fortunate because he got to, fortunate, but in a, it hurts my heart in that the doctors there are risking their lives to manage this disease process. We know so little about the science. We're learning as we go. We're experimenting and giving treatment as we go because nothing has been truly FDA approved in terms of treating this disease process. And as we know, there's a nationwide shortage of the personal protective equipment with the N95 masks, with the gowns, with the gloves. So many things, especially the mask. That was the big respirator mask. That was just the biggest thing. And how long do you use this for? And it's safe and effective in protecting you.
Right.
And these are it turned into more than just the science and treatment. It turned into a lot of ethical issues that was totally unprecedented and totally unexpected on my account. It's the first time I ever made a podcast. I didn't know it was going to be about something that was beyond my wildest imagination. It's gotten into the point where it's like doctors are risking their lives. Is it fair for physicians and healthcare providers that are at the front line to not be properly equipped in treating this very, very dangerous virus. You know, I mean, those are ethical issues. Why rationing care is an ethical issue. We don't have enough ventilators. We don't have enough hospital beds in certain sectors of the United States. So when you have you have this surge of patients coming in and you flood, you know, the healthcare system, who do you give your treatment to? And you don't have enough to give to everybody. Who do you give it to? And that's where these are issues that Americans have not faced. We're not known to face these issues. We're the fastest, most, you know, developed country. We're first at everything. How can we not handle this? I mean, these are things that just really came out that was just totally, I mean, we were very much unprepared. And, you know, I think that, you know, with Italy being, you know, after China, that Italy was hit so hard, that should have been like a big warning sign that if Italy's being devastated by this, that's a good sign that we probably will be too. And that's exactly what happened. Now we have more cases and deaths in Italy. And so we're the number one nation in the world right now that has this very, I mean, very devastating disease process. That's just, you know, we're just ranked number one with the most number of cases and deaths. And so it just turned into something so big, you know, not only for doctors, but for all of us. Like, you know, we're all being mandated to stay at home if we're not an essential worker and practice social distancing so we can try to mitigate, because that's all we have. Those are the only tools that we have in mitigating this disease, is actually respecting and practicing social distancing.
I'm glad you brought that up, because a lot of people, it might not be shown on like the, you know, 5 o'clock news about the issues that are plaguing our frontline healthcare workers, and with the lack of crucial supplies from PPEs and gas masks and gowns and all of that, how it's taking the strain on the healthcare system. And that's why for this month's CreativeZen, we wanted to have, which is a monthly breakfast lecture series for those that don't know, a mini TED Talk where we bring in a thought-provoking, inspiring speaker to share their story one Friday morning a month. For this month, we obviously wanted to bring in somebody from the medical healthcare field that could share not only their experience, but could share some context and insight, and some, you know, real world scenarios. Because, you know, unfortunately, I don't think everybody's taking it as serious as they should be, and as it is. And to your last point, the only way we could mitigate it is to you know, social distancing and quarantine and self-isolation, because the people that have to deal with it on the front lines are not only overworked and understaffed and overwhelmed, with the shortage of supply. So I appreciate you mentioning that. Very serendipitous of the timing for the podcast. I didn't mention that on the intro, but I knew we were going to get to that. Everything happens for a reason, fortunately, unfortunately. But before the podcast, so you just to kind of see how you got here and how you ended up choosing 954. You went and got your undergrad at West Virginia.
No, I got my undergrad at Minnesota, and I got my medical school degree at West Virginia. I did my residency here in South Florida, and I've been here practicing as a full-fledged physician. And then I chose, after 5 years, to still practice family medicine, but to add more to what I do.
And you went to Nova for medical school?
No, I went to West Virginia for medical school.
I'm sorry.
For residency, I came down and I was at Larkin in South Miami for my residency program in family medicine. And then I just practiced on my own for 5 years. And after 5 years, on top of what I do as a family medicine doctor, I decided, let me just get this additional training in corrections. So
everything happens for a reason.
Yeah, it's been quite a unique journey. It has. I think I just kind of take life as it comes, because life has just been unpredictable in good ways, but also in very tumultuous ways. It's not easy to see other, my colleagues and, healthcare providers struggle like this. It's very concerning. You know, we do a lot, not only to serve and help others, but we risk a lot to do this to begin with. And now you want to add this layer to it. It's just, I don't know. It just really, like, for me, it's just like, that's what really like gets to my heart is, it's very, what do you do when your doctors get sick? Like, they're very hard to replace, and they're doing the right thing for all the right reasons. So I just don't even know how to articulate that even better, except that these should not be issues that a doctor should ever have to face. We're facing it, but it's like, why wouldn't we be safe while we're facing it? Those are the things that I know from personal experience, from the conversations that I've had, that a lot of doctors are sad about. What, I don't know. It's just a learning situation for all of us. At least we know that we have each other's backs, and the people that are involved and do have this very serious understanding of it respect it. They respect that, this is a very, very, very crazy situation.
Amen. It's interesting that unfortunately, the way your podcast started off, that you're able to share such great insight on a platform that, once again, the news can only cover so much, right, and they can only show so many frontline healthcare workers pleading for supplies, right, and highlighting the situation. So thankfully, you were able to do that. Sans the COVID situation, and I guess moving forward with regards to your podcast, what type of things in the future, or as you intended to be for when you set out to initially start the podcast, what could people look forward to hearing from and learning about on your podcast in the future?
So I should say the name of the podcast is Secrets of Survival, S.O.S, by Susan Rashid. That's the name, and you can download it on Apple and wherever you download your favorite podcast. It's basically in most of the platforms, and it's also at the website that I had sent to you, www.simplecast.com/secrets of survival. But yeah, what other things that I'm going to talk about is what I was mentioning before. I really want to touch on not only people's personal experience, but also in the USA, but I also am going to go international with that. I've had a couple Italian doctors give me a call, and granted, they spoke in Italian, so I had to have a translator, but it was so enlightening to see how other doctors and other healthcare providers in different parts of the world are handling this crisis, because it is a pandemic. So I think that is something that I'm looking forward to getting more stories and information on. But also I want to discuss about mental health issues. That's a big one. And this is such a broad topic. It encompasses more than just depression and anxiety. There's just so much substance abuse that's going on with drug addiction and the lifestyle that people live as a result of that. Yeah, that's one thing. And the other, women's health, pediatrics, kids' health, teenage pregnancy, and also things that pertain to, not only just the science, but people's theories on things. That's interesting to look into. There's so much talk about, what is going to happen? How does this change healthcare? How does this change our education system? How does this change the way we work now? The economical factor into this. and I know I'm just a physician, but it's all in a unique way very much connected to each other. With this health crisis, we have to stay at home. But as a result of staying at home, a lot of people don't have paid sick leave. They don't have paid sick leave. They don't have, job security to continue on with their jobs if they're mandated to stay at home. I mean, it brings up a lot of things that were issues before this pandemic, but now is like, okay, these are things that truly need to be addressed, because the health of a society is very much connected to the economy of a society.
100%. 100%.
People don't feel good when they don't have a means to provide for themselves, for their spouse, for their family. That adds even more stress. So, I mean, we can't just forget that, how do you, it's a very delicate balance. How do you balance this? How do you really address this in a thoughtful fashion? And I think that the economy of a society before this COVID-19, yes, we were doing well, but there were things that were not addressed in protecting the economy of the society, plus the health of a society. You need to protect your workers and all individuals, because if their health is not good, how are they going to continue being productive in society? So it's so synchronous. It's like a catch-22 in a sense. You can't really do one without the other.
Correct.
So it's just really bringing into light some other creative ideas that I want to look into.
And if nothing else, unfortunately, once again, it is bringing light to a myriad of different scenarios. One of the communities that we focus on with Choose954 and with the podcast is the creative community. When you dial down into it, there's the creative economy, there's the creative class. Unfortunately, right now, people are not going to be buying artwork from artists, as they're, aside from, the ultra wealthy and the 1%, the people don't have disposable income just to spend on buying artwork from artists, which is the ways that artists are supported and monetize their profession. And that's, although it's great that there are grants and things coming online, this is really posing a real scenario that we need to address about, back in the day, artists were supported by the government. The government commissioned artists to do portraits and to do things. And these are going back to the 1400s. And so maybe, and I know in other countries they do that. In Brazil, they have artists on payroll to do murals. So unfortunately, it is shedding light on a myriad of things that really need to be considered for those comfortable and for those vulnerable at risk as well. For you as a medical worker, is there anything that, aside from staying at home and quarantining, is there anything that anybody listening right now could do to support you, if it was a donation of supplies or monetary or any type of support you need that anybody could provide potentially?
I think the big thing that I would like to see is, and I know some sectors of US, I have doctors that call me and tell me, Dr. Rashid, I got my community to make masks, or I'm going to go ahead and get some fabric and cotton. I got people that are great with sewing and they're making masks, and, we're going to go ahead. What are your thoughts on this, Dr. Rashid? We don't know the membrane that's necessarily in N95, but what's similar to it, so that even though, we can't guarantee 100% that a healthcare worker wouldn't get exposed to COVID-19, but at least we can decrease the likelihood of getting infected with, something like a filter to help prevent that transmission. And so I researched into the HEPA filters, and that's been being utilized. Yeah, so that was really cool. NASA had written an article that they have about a 98-99% based on the diameter of the virus that it can combat it, prevent it from seeping through. They just can't endorse that because the way they did their research, it was to a certain diameter, but they found that it could be less than that diameter. And I believe COVID-19 is pretty small. It's like less than, don't quote me on it. I can't put my number, I can't put the finger on it, but I'll send you more information in regards to that. But they were impressed with that. And he's been making, Dr. Norman Wood, he's in West Virginia. He's been making so many masks. And I think, and he's been serving the nursing home community because the elderly, the frail are more at risk of having a bad outcome if exposed to this virus. So he put them and the frontline workers, it's the top of his priority list. So I would really highly encourage, until we're able to get more N95 masks, I would highly encourage those who know how to sew, which is not my stuff. I'm not the best with sewing.
Me neither.
But I would encourage, I mean, if they are able to make masks for the nursing homes, make masks for the incarcerated population here with the local jails and the local prisons, you know, because these two are very similar for different reasons, but they are similar. There's a lot of people in a confined space. That's what's similar. You have a lot of people in a confined space, which already makes them vulnerable, and it already makes them likely to spread it among the individuals and the staff that work to serve these people. So, you know, this would be the top of my priority list, is making sure that these people have a mask of some sort, and the doctors and the healthcare providers that see them, along with our hospitals too, you know, they definitely always need to have masks. But these three groups, from the hospitals to our nursing homes to our incarcerated population, you know, to the various private clinics, yes, but the clinics, you know, the doctors are able to put the patients in a waiting room or say, come back in another hour so that there's less people in a clinic, to decrease the likelihood. But nursing homes are tough because they're older, they have diseases. Prisons are tough because it's not like you can just put them in a different prison and just put 10 people in a prison. You just can't, you know. And so, and there's been a lot of prison outbreak or jail outbreaks in the US right now because of how fast this virus spread. So to prevent anything happening here, I would suggest, like, to that magnitude, I would suggest, like, if we could make masks for these groups of people, that would be great.
100%. I want to give a big kudos to a few artists and creatives in the community that have been making masks. The mask that I've been wearing, that some of you guys have seen, is from Kikimora Studios and Kikimora Fashion. It's phenomenal. And that's one way you can support. She made some more fashionable masks for sale. She's a costume designer. I wasn't able to buy a mask, you know, from the store. So, given the situation and not wanting to wait 8 weeks for a mask on back order, I supported this local artist by purchasing a mask. My dear friend Amanda Perna, who actually is a Broward native from Project Runway fame, one of our former CreativeZen speakers. She's been making and donating masks to various local hospitals with her patterns and design. And Nivea Bronho recently made the other night 100 Star Wars masks. And you're right, if it goes to a nursing home, or if it goes to a jail, or if it goes to a regular person that needs to go out to, you know, go to the grocery store or whatever, that is helping. All this helps.
Right. So, no, and I appreciate you saying that, because grocery stores are an essential essential workers are there. They're serving your produce, your meat, your juices, your dairy, and they don't have, and then they register you out, they cash you out, and so they should also have access to this too, and make sure that they're protected, as well as any individual that obviously we all have to go to the grocery store. There should be no reason why someone can't wear a simple mask, and try to protect others and themselves from possibly potentially spreading, a
100%.
virus. Yeah.
So very good point. Good feedback. Because once again, I mean, listen, not everybody watches the news, not everybody turns on the TV, not everybody, there's a lot of noise out there. But there are knowledgeable, qualified people like yourself that mean very well, that have all the right intentions. So fortunately, and hopefully through this podcast and this conversation, even if we were able to raise the awareness of one person or change one person's perception, you really do need to wear a mask if you're going out there. It really can make a difference in helping flattening the curve and stopping the spread. So we appreciate that. If there was anything else that you, as a medical professional, as a doctor, would want our community to know and the world to know, really, what would be something, if it was a best practice, a tip, or anything right now that you would want people to know and be considerate of, aside from the mask and what we just discussed?
Right. Well, right now, because this is a time of solitude and being alone together, this is a time to reflect. And, the small things that we've taken for granted, being young, having a good immune system, being pretty much healthy, it could change in a flash. Things that you didn't think it was serious, or it was really well controlled, say asthma, say a mild form of type 2 diabetes. It's amazing that though you have it under control, are you really doing everything you can to maintain control? Because these kind of disease process, though maybe you're not feeling it or not experiencing it severely on a daily basis, this kind of virus can just really put a gasoline on that and just really, really take you down. And so, I encourage, things that you kind of just put under the rug or just not make a big deal out of, such as smoking, having a bit more to drink than usual, not exercising properly, not maintaining, a healthy weight. These things don't seem to be at your young age that big of a deal, but it is a big deal. Maintaining good health is just essential for all aspects, from physical to emotional to mental to spiritual. Yeah, I look at things very holistically, and I think that we need to be cognizant that we have to really, really take good, delicate care of ourselves. Because, in the grand scheme of things, we're only given this one body, this one temple, this one complex yet extraordinarily beautiful multi-organ system that it makes you a human being. And there are things about, for instance, the mind that we still just don't even have all the knowledge in the world of, but even this itself, it needs to be given healthy and nourishing thoughts and just practicing good habits. And I think even someone like even myself, I tend to take my health for granted. But I see that with this situation, and it'll probably be, something that'll probably be recurrent in the future, where we're, going to have to be getting prepared for the next COVID-19 outbreak, whether in the U.S. or throughout the world, and in different in probably the fall season or next year. This is something that, is just going to have to start being implemented into our daily lives, that I really need to take care of my health, and I need to take my health seriously, no matter how old I am, no matter what age I am. And for that, I have to make that my number one priority. If I don't have good health, I don't really have much of anything. And so, exactly. So it's like, I have good health, I can conquer anything. If I don't, that's just really sad. And so if you have the ability to maintain and promote and just keep on with good health, it should be really, if there was any goal to really accomplish after this outbreak, is to start taking that sincerely seriously.
Amen. I was going to say, I learned when I've been diagnosed with type 2 diabetes that health is wealth. And it could be very expensive. It could actually really cause a lot of problems if you have bad health and you don't have the means. The medication that I take, one of the medications that I take without insurance is $800 a month for listening. So health really is wealth. And I was sharing with you before we hopped on the podcast, I just started implementing a daily smoothie regimen, with fruits, and I even put kale in there just as one way to combat my diabetes and also give me a new hobby in the meantime. While we're sitting here, looking for things to do, now I have a regimen on something that I follow daily, and it gives me something to look forward to. I feel better after it. I'm getting, tons of antioxidants, and I have my berries in there, and banana and OJ and kale and strawberries. So little things like that can go a long way. So I really appreciate you sharing that. One other thing, another CreativeZen speaker, a previous CreativeZen speaker mentioned that I brought up that I also have been adhering to. Dr. Hackey Reitman of Different Brains strongly endorses incorporating a Mediterranean diet, and there's different proven elements to a Mediterranean diet. So I strongly encourage you guys listening to take this very seriously. You are only given one body, you are only given one temple, you are only given one life, and no one is going to take care of it for you but yourself.
Yes.
So you can find out more about Dr. Rashid and her story this Friday at AAF CreativeZen. We do host it monthly at different venues throughout the greater Fort Lauderdale area. Obviously, considering the situation this month, we're not going to be hosting it in person. It's going to be the first time we're hosting it remotely, digitally. So we'll have a live stream via Zoom. The link is in the event page on Facebook and Eventbrite, and you'll tune in, and we'll still have the same thought-provoking, inspiring talk where she'll share her story and go into more detail. And it's still a way that we're bringing people together to connect and engage and inspire our community one Friday morning a month, once again, in an effort to make this a better place to live and not just a better place to vacation. So that'll take place this Friday morning, April the 17th at 9 a.m. I'll drop the ticket link. It's a free event, but just so you can have a reminder in the comments when we post this on Facebook and on YouTube. And for those that want to follow you or learn more, stay in touch, or tune in your podcast, you want to share just the name of the podcast again, or any
sure.
email or anything?
Secrets of Survival, S.O.S. by Susan Rashid. And you can email me at secretsofsurvivalmedicine@gmail.com if you have any questions. And you can follow me on Facebook. I'm Susan Rashid, and on Twitter I'm at Secrets SOS, and then Instagram Rashid.Susan767. I mean, I'm pretty I'm pretty accessible in that I'd be happy to answer questions and give some cool tools to get through this unique time period that's historical.
Amen. No, we need that, and we're super grateful. I want to thank Maribela Soto for connecting us. She's a great ambassador of our and supporter of Choose954 in our Fort Lauderdale. And when I put it out there that I was looking for a speaker who was fortunately able to, spare some time, during the current situation, we appreciate, your interest in making yourself available, and sharing, valuable thoughts and insight. And who knows, if maybe this wakes up one person and saves one person's life. I mean, I like to think that's a win. One is greater than zero is one of my favorite sayings. So if you didn't know, my name's Evan Snow. I'm the co-founder of Choose954 and our Fort Lauderdale and Zero Empty Spaces and a few other things that we do. But I really appreciate you guys tuning in to find out some more about us. You can reach out to me at EvanSnow13 at Instagram, at Choose954 on Instagram, at Evan at choose954.com with any questions and email. Love to hear why. Well, actually, one last thing we always like to ask. Why did you choose the 954?
Why did I choose the 954?
Yeah. What do you like about this place?
What I love about this place? Well, I mean, South Florida, everyone, the weather is fantastic and you're by the ocean. I love the water. So that moisture is just good to open up the airways. And it's young, it's full of diversity. There's people from all over the world that you get to meet here. And there's always so much to do, so much to learn. It's a good mixture, not only the young, but also, you definitely have the geriatric, the older sector of population. So, it's just, I mean, this in New York City, I love Manhattan. I love to just be around so much diversity. I think we all have so much to learn from each other, and it always keeps things really, really exhilarating and just exciting. And so I love being in South Florida. It's cool.
Amen. Very well put. And as some of you, my friends and followers, have expressed their concerns, as I'm generally a very social, active, outgoing person that hosts a lot of events, attends, participates, and supports a lot of events. I am doing all right. I'm very much looking forward to the rebound and the comeback, because I know people are going to want to come out and be together amongst like-minded individuals, amongst other members of their community. And we are working on some new things and implementing, social distancing when we do get back to normal, and pivoting maybe, some of our previous events, and creating new events and new platforms and new opportunities and new Zero Empty Spaces. So lots of good stuff. We encourage you to stay tuned to Choose954. We hope you guys can join us this Friday morning at 9 a.m. for the live stream. And we'll repost the playback later on our Facebook and YouTube page as well. I'd love to hear why you choose 954. You can reach out to me at evan@choose954.com. And we hope you guys stay safe, practice social distancing, and we'll see you on the flip side. Cheers.
Cheers. Thank